Hi everyone, Jeremy from Phoenix Regen, and as promised in one of our last videos, what I'm going to do today is trying to explain to you really quickly generally how different shoulder injuries present and how we try and identify what's called the pain generator. So identifying the pain generator is one of the most important things we can do in musculoskeletal medicine, okay? And it means exactly what it sounds like. We have to find out what tissue is damaged and what is generating your pain, okay? Not necessarily why that tissue is being damaged or giving you pain, but where it's coming from, okay? And there's a few little subtle things that we use to help us as practitioners, whether you be a sports doctor, whether you be a physiotherapist, a chiropractor, or a doctor. And one of the two most basic things we get is when patients actually get the pain, okay? So typically, if you have shoulder pain, people think, oh, is it there all the time or does it come intermittently? So does it come only at certain times? Typically, muscle injuries in the shoulder are worse when you actually use the muscle, so when it's actually in motion, okay? With my particular shoulder injury, I had no problems using the muscles, so I had no restricted motion and I had no weakness, okay? Now, so muscles out of the way. Also, when we now look at things that are outside the joint, then we next look at ligaments and tendons, okay? Now, these tend to be worse when you are not moving. They tend to be better with movement and get worse without movement. So what can happen a lot of times with chronic tendonitis is that patients actually, they go to work, they feel great, and then when they go to bed, they were woken up with horrific pain on the outside of their shoulder, and they think it's this muscle here, where actually it's one of the tendons in there. Personally, I know this myself, that when that tendon is inflamed, even though mine was acute, when I was working, when I'm moving, when I'm doing my normal stuff, it's absolutely fine. But around 4 o'clock in the morning, it was horrifically painful, okay? Now, the other thing is when we look inside the joint. Now, again, you've got the tissue inside your joint, which is sort of the synovial fluid, which is basically the lubrication inside your joint. That also tends to be, you maybe have some restrictions when you're moving, but tends to be worse when you're not moving. And so these are, again, issues that can be, that patients complain of pain and a real deep ache when they're not doing anything, like late at night when they're trying to sleep, when they're rolling over in bed. That tends to be. And so it is rather difficult to differentiate between, is this a tendon problem or is this a joint? Is this an actual problem coming from the tissue inside the joint or the cartilage? And that's where expert diagnosis and physical exam and sometimes imaging comes into place, okay? So I hope this has given you guys a little bit of a better idea about shoulder pain, and even if you've got shoulder pain, so that you can start to think, is this coming from inside the joint? Is it outside the joint? Is this when and what activity? Is it better with movement or is it worse with movement? And that can help to give you a little bit of tips on what your most likely pain generator is, where your pain is coming from in your shoulder, okay? In the next video, what we're going to do is I'm going to tell you a little bit about what I've done for my own shoulder, where I've got an acute tendonitis and inflammation in the joint, what I've done to try and help that healing process just happen faster, okay? Really looking forward to talking to you about that. And in the meantime, guys, have a lovely day.